I'm your friend, Dr. Charles Apoki. I want to do a video on Venerophobia. Venerophobia is the fear of having venereal disease or having had venereal disease. You have it in your mind that you have a venereal disease. And it is a common problem in Nigeria, but men don't talk. Men don't cry. They don't share their problems and their experiences with people. And so, a lot of them are passing through difficulties and challenges without letting any person know. If you are in a big bus traveling in Nigeria, you will see some charlatans come and introduce themselves as specialists, tradomedical practitioners, and they will vomit a lot of nonsense. And I'm always amazed to see educated people buying their concussions. And even on radio, you'll see Baba this, Mama that, come to talk about Staphylococcus aureus. Some of them don't know how to pronounce it. They'll say Staphylococcus aureus. Now, Staphylococcus aureus is not a venereal disease. Simple thing you will Google. It is a normal commensal organism that exists on our skins, exists in your nostrils, exists on your skin, exists in your labia majora, in your the anterior part of your genital tract, exists in the tip of your penis. And so, Staphylococcus aureus is not a venereal disease. Many of our laboratories, private laboratories, are supposed to be closed down because they are dishing out very rubbish results. I sent somebody that is supposed to have had trichomoniasis or candidiasis. They came out with a result of Staphylococcus aureus and prescribed very expensive and toxic antibiotics. Now listen. Staphylococcus aureus is at the tip of your penis. So, if you want to do a urine culture, you don't give somebody a bottle that you boiled to go and pee into. Number one, you sterilize that bottle. It has to be a sterilized bottle. Number two, the bottle contains boric acid. Boric acid, either the bottle contains boric acid or the culture medium contains boric acid. Boric acid inhibits the growth of Staphylococcus aureus. And you don't tell the man to urinate into the bottle, the whole urine, or the woman. The first thing you do is to tell the individual to collect only midstream urine. That's why it's called MSU. The man will first pee some out. In some cases, they even swab them. Pee some out. Then it is the middle urine he will collect. The terminal urine, he will pee it out. So when you use a sterile bottle, and if that bottle has been impregnated with boric acid or the culture medium is impregnated with boric acid, Staphylococcus aureus will not flourish. It will not grow. And then all these nonsense lab results of Staphylococcus, heavy growth, that people are taking antibiotics here and there, spending a lot of money buying concussions. That's why we are seeing a lot of kidney failure. A lot of these medications are toxic. They don't have doses. They are not regulated. Just drink concussions and you get into trouble. Now, what will Venerophobia do? Number one, it creates anxiety neurosis. You start having hotness in your body. You feel palpitations. You feel fasciculations. Your body will just be contracting anyhow. You cannot sleep well because of the tension. Your intestines can be contracting too rapidly. You will hear noise in your tummy. And these are the things that these quacks use to convince you that you have Staphylococcus aureus as a venereal disease. It is your body reacting in fear to the fact that you have venereal disease, which you don't have. The reaction now creates these psychosomatic manifestations something moving, crawling on your head and all that, and then you will keep spending thousands of naira foolishly. The other thing that can happen is that your libido can be affected because of fear that you might contaminate your wife, infect your wife with sexually transmitted disease. You don't have an erection, and so you can't perform. Number two, you will be thinking that you caught the disease from your wife, and your wife is innocent. The resultant effect, when you want to sleep with her, you will start feeling nervous and you won't have an erection. So, I just hope that this video, you can Google whatever I've said. I just hope that this video will set you free from the grip, the snare of Venerophobia. I remain your friend, Dr. Charles Apoki. God bless you. You can send your questions to me on +234 70 52 13 6763 to join my WhatsApp mentorship group. I remain Dr. Charles Apoki. I am my friend. God bless you.